Good evening. London has been on lockdown for a week now, but yet again during this morning's rush hour, the unwelcome sight of tube carriages packed full of people. The Mayor of London says progress has been made, but with services on the underground and rail networks scaled back, his critics say the lack of social distancing is still unsafe. Meanwhile, the latest figures from the government show almost half of all new cases of COVID-19 are here in the capital. Our political correspondent Simon Harris has more.
1 week after we were told to stay at home, the rush hour still looked like the rush hour on some parts of the tube. This was North Acton, where many commuters have to change trains. Social distancing is meaningless here, in the carriages and on the platforms. The Mayor's opponents called on him to improve the service.
He has made the point that people shouldn't be travelling, but we also know there's a number of people who have to travel. It is up to him to make that journey safe for them, and it's a real shame that we don't seem to be able to manage that.
Transport for London says it's managing to run half of its trains and fewer Londoners are travelling. But on 3 lines, the Central, Jubilee and Victoria, the problem of overcrowding continues.
There's been huge progress made. So if you compare this Monday versus last Monday, we have around 9% fewer journeys on those lines, which is really good. On the buses, we're seeing fewer journeys as well. And so people are changing their behaviour as they should, but we still need more Londoners to stay at home.
Stopping the spread of the virus is only part of the battle. Saving those already infected is another. And at University College London, there's been a remarkable breakthrough. Technicians and doctors working with the Mercedes Formula One team have developed a breathing device which could mean fewer patients needing intensive care.
It seems to work perfectly well. It delivers the flows and it delivers the oxygen that we need to keep these patients' lungs expanded. The patients are able to tolerate the tight-fitting masks and it looks like it's doing what it should do.
It's taken just 2 weeks to develop the idea, which involved reverse engineering an old design and getting it approved.
Usually it takes years to do this kind of thing, but I think there's been a real groundswell of positivity amongst the academic, engineering, healthcare, industry communities to contribute to these efforts.
Speed could also be a lifesaver at the ExCeL Exhibition Centre in East London. It's now being transformed into the NHS Nightingale Hospital. The first patients could arrive later this week to ease the pressure on other intensive care units in London. Eventually, there'll be beds for 4,000 patients.
There's still a lot more work yet to be done, but huge progress about building a hospital in London, Nightingale London, in just less than 2 weeks. It is unbelievable.
It won't just be NHS staff working here. Airline cabin crew who are trained in first aid have been signed up. Ashley Brown is normally based at Gatwick.
We'll be on the front line working with nurses, clinicians, senior doctors, changing beds, following them around the wards.
The virus has spread at an alarming rate in London. It's just 3 weeks since the first patient died. Today, the death toll in London is close to 470. Simon Harris, ITV News, Central London.
Good evening. There has been another sharp rise in the number of people who have died after testing positive with coronavirus. In London alone, the government confirmed almost 4,000 people are being treated in hospitals for COVID-19. And the Mayor of London told this programme there are hundreds more people who have died here. It's as NHS Nightingale, a temporary hospital at the ExCeL Centre, prepares to open its doors tomorrow to its first patients. A sobering reminder that the capital is at the centre of the outbreak in the UK. Our political correspondent Simon Harris has the latest.
So we're now at the east end of the ExCeL, and this is the end where the ambulances will be brought in.
The sound is echoey, the picture's fuzzy, but hopefully this is as close as most of us will ever get to the Nightingale.
You will get a sense of just how big it is.
This virtual tour of the 4,000-bed intensive care unit inside East London's ExCeL Centre was laid on for the Mayor as the death toll in London rose again.
We have set up a process by which relatives can visit their dying relatives.
To give you a scale of the challenge, we have across London about 800 ICU beds. We need, over the next few weeks, about 8,000 ICU beds. And so the Nightingale gives us about half the capacity, and the other half will come from our hospitals reconfiguring facilities to provide the additional ICU facilities that we need. Well, the bad news I've got to share with you is yesterday we in London lost more than 700 people in total. That was the latest figure from yesterday. More than 700 people who've died had COVID-19.
The Nightingale will only admit patients who arrive by ambulance from hospitals across London, and they'll all be on ventilators. Those who recover will then be moved to other hospitals by St John Ambulance, which relies on volunteers.
There's an opportunity for employers to release our volunteers to us to make a very real difference. So obviously we're encouraging the nation to stay at home to save lives, but I'm encouraging our volunteers to step outside their front door to help save lives.
The car park at the IKEA store in Wembley has now become a drive-through virus test centre for health workers who are given a mouth swab at the wheel of their car. The lack of coronavirus tests for NHS workers has become a real problem. Many staff have followed advice to self-isolate after developing symptoms, but they might not have the virus and could still be at work. Another test centre has been set up at the Chessington World of Adventure near Kingston.
I think the fact that these centres are being set up around the country is an indication of how quickly coronavirus is spreading and the enormous impact it's having. I mean, it just shows that our usual healthcare facilities aren't enough to withstand the enormous pressure that this is putting on our health service.
The first patients in need of life-saving intensive care could arrive at the Nightingale as early as tomorrow.
Simon, NHS Nightingale there, almost ready, which is reassuring, but still really worrying picture on the tube this morning.
Yes, yet again we saw passengers crowding onto platforms at an underground station, despite pleas to workers to stay at home or avoid the rush hour. These alarming images were from North Acton again, and they show Central Line passengers failing to comply with the 2-metre social distance rule. The station has become a daily hotspot for overcrowding, following cuts to the timetable. There used to be a through train from West Ruislip to central London, but that's now been replaced by a shuttle between West Ruislip and North Acton, forcing commuters to change trains. It's true that millions of Londoners have using the tube. On the last Friday in March in 2019, there were 4.2 million passengers, while last Friday the figure was down to 240,000. So that's a drop of 95% of the normal number of people using the Underground. But clearly North Acton has been a problem. But I'm told tonight that Transport for London is now hoping to resume through running from West Ruislip so passengers can avoid using that interchange.
All right, Simon, thank you. Good evening. The grim reality of contracting coronavirus became all too apparent today when it was confirmed a 13-year-old boy from Brixton who had COVID-19 died alone without his family by his side. He was being treated at King's College Hospital after testing positive for the virus, but a family friend says not even his mum was allowed to be there to comfort him in his final hours because of the risk of passing on the infection. Meanwhile, on the other side of the capital, there was more unpleasant news for NHS workers as some were turned away from a testing facility in Wembley. News came with the latest. Here's our political correspondent, Simon Harris.
Ismail Abdul Wahab was on a ventilator. He was in an induced coma and he was just 13 years old. Ismail was being treated at King's College Hospital in South London after testing positive for COVID-19. And when he died, his family wasn't allowed to be at his bedside.
Because of the need and the way that this virus itself is, no one else is allowed to be around that individual. And that means you're on your deathbed in your last moments alone. And he was a young boy, age 13, without his mother, without any sibling on his deathbed in the last moments. And that's very hard to sort of digest.
Behind the wooden fence on Wanstead Flats in East London, there was another stark signal today of the pandemic's grip on the capital. This is where they're building one of 3 temporary mortuaries. There's another in Westminster and one in Ruislip. In Docklands, the new NHS Nightingale Hospital is almost ready to open its doors. It's a 4,000-bed intensive care unit designed to ease pressure on other London hospitals.
What we really want is the people of London to not need this facility by staying at home, by washing their hands and social distancing. It's absolutely imperative that they help us to not really need this facility if at all possible.
Other parts of the NHS in London are also coming to terms with the challenge of the looming surge. The London Ambulance Service is doubling the size of its fleet from more than 300 to 650. It's buying second-hand ambulances which are being reconditioned, and firefighters are being drafted in as drivers.
They're blue light drivers, they're used to dealing with emergencies, they're medically trained, and with a day's additional training, they're the ideal people to co-crew an ambulance and provide that service to London and Londoners.
Having the LFB join us and the number of people that we've had offer to volunteer to work with us and keep the service running is fantastic.
In the car park at IKEA in North London, health workers queued today to give swabs to find out if they were infected. This is one of the emergency testing centres for frontline NHS staff. But some were turned away because they didn't have the right paperwork.
They said without a confirmation email that you won't get tested. So they're turning away NHS staff now as well.
I travelled all the way down from Erie to Kent. That was about 2 hours drive down here. And then only to be turned back. That is quite discouraging.
They've got 5 bays and they've only got 2 of them open. It's a farce.
On the front line, hospitals, ambulances and mortuaries are being readied. But it seems the plan to give NHS staff the tests they need isn't keeping pace.
And Simon, we learn more today about the sombre process for what happens when somebody dies at home.
Yes, it's thought about a third of all deaths will be at home, not in hospital. And today we heard about something called Pandemic Multi-Agency Response Teams, or PMARTs. Now, these are teams of 4 people. One of them will be a clinician, either a doctor or nurse, who will turn up at the house to confirm that the patient has died. There'll also be 2 police officers to check there are no suspicious circumstances. And the third member of the team will be the driver, who will be a London Fire Brigade firefighter. They will also have the task of ensuring that the body is placed into a bag and sealed before it's taken to one of those temporary mortuaries. And after that, I'm afraid that no members of the family will be able to say any final goodbyes.
It's very difficult. We've talked a lot about the tube still being busy. There's been a development on that, hasn't there? Because very different today to how it was yesterday.
Yes, it was a week ago that we became aware of a problem at North Acton Underground Station, and it was still going on yesterday. What we saw was crowds of commuters yesterday, as we have seen all week, coming off trains, changing trains at North Acton, crowding onto the platform and simply unable to comply with the 2-metre social distancing rule. These were Central Line passengers getting off a train from Ruislip, and the picture certainly caused a row. Well, today, things were much better, as you can see now. London Underground says it's now got enough drivers to take most of the Ruislip trains all the way into central London instead of terminating them at North Acton, so the passengers don't have to get off there and cross the platform and wait for another train. Staff are also painting lines on the platform so passengers can judge what 2 metres is.
All right, definitely an improvement. Simon, thank you.